Okay, well, welcome everyone. Thank you for being here. I need to tell you right before we start that there's a protocol. We will record the lecture, and so just that you're aware of that. And when we have our Q&A, your questions will also be recorded. If you're not okay with that, then you'd have to let us know, but I assume that you are, so just ask really intelligent questions. They will be on the recording. My name is Jens Zimmermann. I'm Professor of Theology and Director of the Houston Center at Regent College. Regent College is a theological graduate school affiliated with the University of British Columbia. And the Houston Center fosters interdisciplinary and interreligious dialogue on the question of what it means to be human, and then consequently what it means to flourish, i.e. what kind of a society or communities do we require for human flourishing based on the identity that we assume. Obviously, these questions are of central importance because what we desire and how we act always depends explicitly or implicitly on who we think we are. And so here at the Houston Center, we explore the conceptions of human identity and the implications for social and political practices. And we've had a number of speakers on a variety of topics to address these questions. As a Christian institution, we approach the question of human identity from the center of a Christian belief that God made human beings in his image and that God himself became human in the person of Jesus to show the world what true humanity is like and to restore and perfect all of creation. Now, it's precisely this teaching that grounds our Houston Center's mandate to dialogue with anyone who is interested in the question of human identity. I mean, along with the centrality of the incarnation and so on, the belief that the Logos became flesh, we obviously believe that there is one Logos toward which we're all arguing, and in our different ways, cultural traditions and so on. And so this is all about dialogue on the basis of this very central teaching around the question of human identity and human flourishing. And certainly one area of interest for our human identity is, in fact, healthcare, the body, the nature of the human person. Now, contrary to nasty rumors, the Christian doctrine of the incarnation and of the bodily resurrection have in fact made the body a topic of great interest within Christianity, right? I mean, there are these kind of strands of thinking that say that religious folk are escapists, or that they denigrate the body. I think it's profoundly untrue. At least in the early church, the body, the human person, was regarded as an embodied spirit, a psychosomatic unity. And then that view kind of disappeared with the advent of a more dichotomous, dualistic understanding of human identity that shaped a great part of our Western medical understanding of healing and of the person and so on. So somewhere since the 17th century, if I can be that loose, there has been a view strongly shaped by the understanding that the human person is a consciousness, a mind, or a self that is encased in a body, and this body is basically a biological machine. Now, this view has worked in many ways, to objectify the body in this way, to produce medical techniques and a great deal of progress in that way. But it is also obviously a shadow side, as our speaker might say. And this view has deeply shaped how we view ourselves, our relation to others, and our relation to the environment. And that view does continue to operate in today's medical healthcare practices, although it's also being contested from within. And today's speaker is going to introduce us to a different view, to a more integrated, holistic, embodied view of ourselves, and how this view affects our understanding of suffering and of healing. So let me introduce Dr. Drew Leder, who we're very pleased to have with us. Dr. Leder was trained as a medical doctor, but then turned to philosophy, and especially to the philosophical school of phenomenology, this kind of descriptive mode of careful attention to how things disclose themselves, to delve deeper into the nature of the human body. Dr. Leder teaches philosophy at Loyola University in Maryland in the US, and he has written 3 groundbreaking books entitled fittingly The Absent Body, The Distressed Body, and The Healing Body. And he will draw on this work today in his lecture entitled Human Being in a Body on Illness, Aging, and Healing. Now, Dr. Leder has caught a bit of a cold and tested. And he is, so I'm deeply appreciative of his being there. He wants to be cautious on our behalf, and he's also a little bit weakened by that. So I've promised him that after the Q&A, I'll pretty quickly get him out of here to get him back home. So let's be appreciative of him spending his time with us, and please help me welcome Dr. David.
Thank you so much, Jens, Dr. Zimmerman, and the Houston Center, and also I bow to everyone who came out this afternoon. Thank you for coming. By the way, when Dr. Zimmerman said I had a bit of a cold, I actually have COVID-19. So I certainly don't want to infect anyone, especially talk about illness and healing. So I'm just sort of warning if anybody's immunocompromised or concerned, maybe sit farther back. We've agreed that I would take off my mask because it's awfully difficult to have this discussion through that. So let me start with seeing if I can negotiate my way through PowerPoint. So this was a previous book that Dr. Zimmerman mentioned called The Absent Body. And it's an interesting title and maybe an interesting cover picture from Magritte, because in some ways the body is that which is most present to us as we go through our life. We never really go anywhere, we might say, except that our body is there and present and with us in many ways is us. And yet it's kind of interesting the ways in which it can be absent from our experience. We can forget about it. And what I try to disclose in the absent body, using, as Dr. Zimmerman said, phenomenology, is kind of a taxonomy of these different modes of absence. The first one, as you can see, I'm calling it ecstatic, which is a term from Heidegger that, literally etymologically means something that stands outside of itself. Like when you're ecstatically happy, you've jumped outside of your limits. And that is something the body is doing continuously. For example, as you look toward me or toward the PowerPoint screen, you're not seeing your eyes, you're not seeing your head. You can do an interesting experiment. If I were to say, point to your hand and look at your hand, you probably could do it. But if I were to say, point toward your eyes and point toward your head, you would kind of find there seems to be nothing there. Oh my God, like that guy there, my head has gone missing. And of course, what's happening is because the head and the brain and the optic nerve and cornea, etc., are right at the epicenter of projecting outward into a visual field, it thereby has to be transparent and concealed from itself. To use the language of Michel Polanyi, we're seeing from our eyes to the world. And that's not only true in a sensory way, but it's true in a motoric way. When we're walking, we're focused on walking toward a destination in the future. We're not, for the most part, focused on our limbs. So this whole kind of surface sensory motor body is absent as ecstatic. At the same time, of course, there's this whole internal body. You just have had lunch. And while your lunch was out there, maybe you were interested in it, focusing on it, tasting it. Now what I'm calling your recessive body, your visceral body, has taken over the task. And the crucial job of digestion is being done without the need for your awareness or your control. You wouldn't even know what to do if suddenly the control was put in your hands. And of course, what's happening is not even exclusively your human cells, but your microbial colonies, since most of the human body is made up of non-human cells and biological material, all of that stuff is doing these things in a certain sense for you without the need of your conscious awareness. And of course, this would often refer to respiration and blood circulation, et cetera, et cetera. So what does it mean? What are the implications of this kind of absence of the body? Well, I think this is one phenomenological, one experiential antecedent or causative factor of what Dr. Zimmerman's was talking about a little bit. The notion that we often, even though this isn't really true to Christianity, we often conceive of ourselves as if we were solely or essentially a mind or a soul or pure rationality, something that's really kind of disembodied. The very fact that the body deletes itself from our awareness, once again, is an experiential underpinning for this persistent notion in Western and other cultures. The true self is fundamentally disembodied. And another correlate is that the times when we most remember our body, not exclusively, but often are times of dysfunction. For example, now that I have COVID, I'm certainly remembering my body. I'm discovering what I can and can't do. It's demanding the need for rest and special care. So in that kind of existential area of illness and pain, that's a time when our body demands attention. I'd also, and once again, I investigate that in this book, if you look at a philosopher like Descartes, he's very concerned with perceptual, epistemological error caused by the body. We might see somebody we think is a friend of ours across the plaza and start to wave to them and realize, no, it's a stranger who we don't really know. Or we might see something that we think is very close up and realize it's a much larger object than we expected, farther in the distance. So the body also leads us into error in the realm of knowledge. And then in the realm of ethics, the lusts of the body, the emotions of the body, the desires welling up from that visceral body can lead us into what theologically would be referred to as sin, kind of missing the mark. And this is, some of the source of the notion of the flesh, is particularly associated with dangers and sensuality and misleading impulses. So once again, if the body is eradicating itself from awareness at times of unproblematic function, but stepping forth most prominently at times like error, sin, and illness, it can get a bad rap. This can be one of the reasons, as Dr. Zimmerman was alluding to, that the body is distrusted by philosophers, by theologians, and by we ourselves, who are concerned with, as the Siddhartha Gautama saw, on the way to becoming the Buddha, he saw an aging person, an ill person, and a dead person, a corpse, and he awakened to the nature of human suffering. So once again, the body becomes associated with all that. So let's focus particularly on this issue of illness, injury, disability, aging, which has, as the Buddha saw, really applies to all of us. What do we do? Well, the first thing I want to do is just create a little bit of a terminological landscape and series of distinctions. when we talk about the body, I'm not necessarily referring to the biomechanical body that is objectified within medicine and medical tests. Obviously, when I did a COVID test a couple of hours ago and I was looking to see whether that COVID line emerged or not, unfortunately, it still did. And I was getting fainter by the day. And my wife has forbidden me to fly back to the States until I've gone totally COVID negative. So I may get to spend a couple more days in Vancouver. So there's that body that registers like a material object in the world that can be objectified either by looking at one another or by more sophisticated biomedical probings. But there's also what we call the lived body, the body as we experience it from within, that first-person perspective. And that's what we're primarily focused on today, partially because it's so neglected within modern medicine. So we'll use the term illness, you see this sometimes in the medical humanities, to refer to that first-person experiential register of what happens when, from the third-person biomedical point of view, we have a disease. We'll make that distinction. And I'm going to be talking today about healing in the face of illness. And once again, I'll distinguish between my somewhat existential use of the term healing from any biomedical notion of, let's say, the healing of a skin wound or the cure of a infectious disease or frozen shoulder or whatever. I'm particularly interested in healing when there is no cure, because increasingly with our aging population, some of those very curable infectious diseases are being taken care of, and that's a wonderful thing. But we still have the more chronic diseases and injuries and modes of disability that come just with living and with aging. Before I talk about healing, first I have to talk about what is being healed, and then I'll explain a little bit more how I'm using the term healing. So what I would say is being healed is a series of disruptions that come about when our physical body breaks down in various ways. It could be an injury, disability, illness, aging. And this is accompanied by a whole series of disruptions. First of all, we have a kind of disruption of our relationship with our own body. Usually we kind of unproblematically live from our body to the world, and we count on that recessive body doing its thing without any attention on our part. But now that the body is problematic, for example, now that I have COVID, I really have to pay attention to it. But it's kind of alien presence. It's not quite me. I went for a walk earlier today, and I noticed an unaccustomed heaviness in my musculature. I'm having to pay attention to my fatigue and my respiratory symptoms. So it's there, but it can be there kind of as the intruder, the stranger, that being which is upsetting and restricting our plans. So it can be a kind of troubled relationship, at least initially. But also our relationship with the world of space and time is also affected. Ordinarily, we're living from a habitual past, projecting ourselves toward various objects of desire in the near and longer-term future. But that's disrupted, especially when we have a serious illness. We no longer feel quite the same person as we were previously. We don't know if we'll be able to follow through with our vacation plans or our professional plans. If we have something like pain, a serious pain, time starts constricting down into the immediacy of the present. We may not even be able to think about 2 or 3 minutes ahead because the ouch is right now. And it's also right here. The spatial world has also constricted. I had a weird peripheral neuropathy. I still have it, but it's under control well. But it was an extremely painful point in my left ankle, a little bit above my left ankle. It was a little bit too high for a foot doctor to feel comfortable dealing with. It was a little bit too low for other orthopedists. It was a little bit too beneath the surface for a vascular surgeon to feel that it was their problem, and nobody could figure out what it was. But I could draw a circle around it with a magic marker. It was a little bit like the size of an American quarter. And all my attention was flooding to that little piece of my body. And whereas customarily I'm a big walker, I walk 4, 5, 6 miles a day with my dog, and it's my pleasure, it was difficult even to walk to the bathroom. So once again, my world was constricting around me spatially as well as temporally. And then that also disrupts our relationship with other people for a number of reasons. We can't go about the customary activities that they're involved in. We're kind of singled off by what's happening within our body. There's a wonderful book by Elaine Scarry called The Body in Pain, where she talks about how pain is sort of incommunicable. The language we have for pain, we could say this is a burning pain or it's a pinching pain, but it's a very limited vocabulary. It doesn't really begin to communicate the complexity and the challenge of what's going on in your body. Nor do other people necessarily want to hear about it because they can't fully empathize or they don't want to, because the vulnerability of the body that you're exhibiting is not necessarily something they want to think about a great deal in the way that Siddhartha Gautama did, because it made him aware of the fragility of life, the vulnerability that kind of hovers just out of our point of view for all of us. And then finally, also disrupted is, as I mentioned previously, kind of our customary sense of identity, meaning, who am I, what can I do? I'm going to talk about that a little more later. And even the notion of God. We're in a center that does have a significant relationship with religious issues. This question of why did this happen to me? Am I being punished? In fact, the word pain comes from the same Latin root as the word punishment. So many people do go to an experience that I'm being punished for something wrong I did, whether by God or, I feel like maybe I should have worn a mask while I was on the airplane, and it's my own damn fault that I got COVID. And my daughter, who did wear a mask on the airplane and didn't get COVID, will remind me of that it is my own damn fault. And I have to keep telling myself, no, COVID is one of these things that happens. But people can really feel like either God is punishing them or God isn't there for them, or maybe there is no God. Maybe these things are just random and contingent, especially if it's a serious illness like a childhood cancer, for example. So back to healing. If these are all modes of what I would call disintegration, the loss of integration with the body, with our world, our social world, our religious and cosmological world, healing would be a kind of process of reintegration. Once again, even if it's maybe a chronic illness that has no medical cure, all the more important that we find ways to reintegrate our life such that we can still move through the world with, whatever level of functioning is possible for us, and we can still find meaning and satisfaction and fulfillment despite bodily breakdowns and limitations. So this is the primary topic of that newer book, The Healing Body. See, I didn't really mean to do that. I meant to go over here and play from current slide. So what do people do when they're faced with these kinds of challenges? Even though I have a medical degree, I'm not primarily interested in the doctor-patient relationship and the role of the clinician. I think that's very significant. I'd like to reach out to clinicians, but I'm primarily interested in what people do themselves, often irregardless of the medical system, independent of the medical system, sometimes assisted by the medical system, sometimes obstructed by the medical system. And yet human adaptation and resilience to aversive circumstances is really quite impressive and really quite artful. I guess I went to the wrong slide. Let me flip through this. Oh, I know what the issue is. I'm out of my PowerPoint and I'm going to go over to my my website. And on my website, it's just drewleader.com. I have something I call the chessboard of healing. And what I'm saying is that even though there have been many studies in medical anthropology and medical sociology about this issue of adaptation and resilience, they work with different patient populations, different methodologies, they come to different conclusions. Literally, there's one study I know that tries to do a kind of meta-analysis of 106 different studies on adaptation to chronic illness. And I'm instead starting more from my background as a philosopher with these fundamental structures of lived embodiment that we've started talking about a little bit. There are philosophers like the French philosopher Merleau-Ponty, the German philosopher Edmund Husserl, and many other people subsequently who have kind of tried to map out the structures of the living body. One of the ones, a first ambiguity is this sense that in some ways I am my body. I would simply say, I am talking to you, and you are listening to me, and we are having a conversation. So the fact that my vocal cords are producing this sound, my body is keeping me upright, your ears are receiving the sound waves, we wouldn't make a distinction between that physical body and really who we are. I simply am these bodily powers lived out within the world. But at the same time, there also is a sense that I have a body which is not fully identical with myself. It's something that can be weighed and measured, looked at and judged by other people. It has a material being within the world, like a table or a chair. But I'm a little bit more than that. I'm a little bit different than that. So it's kind of a possession. So, I might say, might be an example. I have a broken leg. I wouldn't say I am a broken leg. I would say I have a broken leg, just like I might say I have a broken suitcase. The handle doesn't work. And I mentioned how, particularly at times of illness and disability, that sense of moving away from the body can become paramount. Although there are other ways in which the feeling of I am my body, and therefore I am very limited by what's going on, also steps forth in the way both sides of the dichotomy step forth. But this also means that in terms of our healing strategies, that we can go in different directions. The idea behind this chessboard of healing is that though it'd be nice to have a very simple, I'd probably sell more books if I said, here's the 3 weird tricks for healing that you can utilize, think positively, use this visualization technique. My sense is that there are different strokes for different folks, different personality types encountering different illnesses at different stages of progression. So I don't want to put the strategies that are available to us in any kind of a hierarchy or any kind of a sequence. I think they all are good, and they all have their shadow side if used excessively or inappropriately. So let's say we lean toward, I have my body, but I am not my body. There are ways in which we can escape our body at times of illness. And while I play on this chessboard, I think I'm going to use my own experience with COVID as an example of trying to map out where I'm moving my pieces. And you might, if you are struggling with anything, you also can figure out where you are at the chessboard. So I kind of started out by ignoring, I guess I have a little bit of a cough, maybe it's just allergies. And I think of ignoring the problems that you're having at a bodily level, not as a very primitive technique, but actually fairly functional and fairly sophisticated, because we're able to not have the body take over our focus of attention, even in terms of sophisticated pain theory, the state of current day pain theory. The more you pay attention to pain, the more you begin to tune it up, just like if you begin to pay attention to a conversation in a cafe, it's as if you've turned up the volume, whereas if you ignore it, it recedes. And similarly, ignoring pain can stop an acute pain from turning into a chronic pain even after the peripheral stimulus has disappeared, because you're turning down the pain signal. Another mode of healing that I'm using right now is simply refusing to be limited by the body. It's not going to stop me from giving this talk and being with you. And if you put these two together, once again, many people use them, they remain very functional, but obviously a shadow side to both is that you can remain in denial about what's going on with your body. You can not be caring for your body or seeking appropriate treatment. Things can get worse. I'm going to skip down to transcending, which is to basically say there are all kinds of aspects of the self that transcend simply what's going on in my physical body. This would clearly be true about spiritual elements, whether we're meditating or whether we're turning to God, or even if we have a fatal illness, whether we're putting ourselves in God's hands and maybe anticipating an afterlife. There's all kinds of ways to feel like who I am transcends this disease I'm dealing with. But even on a simpler level, we have faculties of imagination and intellect. So through the night and this morning, I've been sleeping and resting and sleeping and resting, but I've been listening to a couple of really good books. One is Dr. Faustus by Thomas Mann, a favorite author of mine. One is a book on cosmology. So these are ways in which I expand my world despite the fact that my body is laying still in bed. So I guess I'll leave lit up, especially refusing and transcending for what I'm doing at the moment. But the opposite direction from moving away from that body is actually to move toward it, to say, I am my body, or if I'm not quite identical to it in the way that I was in health, I'm at least with my body. We're close companions. And I need to accept what's happening, not try to simply ignore it, or pretend that I'm able to do everything I used to. Also, I need to really listen, perhaps even more carefully than I have previously, to the messages that are coming from within my body. I call these kind of inside insights, the insights we get from paying more attention to our body's messages about the level of activity or rest or nutrition or care that it needs, which in our culture we often can be somewhat oblivious to or focused on overriding so that we can go to work or be fully functional in a society that rewards productivity and not letting your body get in the way. And it's also very important to be befriending your body, have compassion for what you're going through. I'm trying to do a little bit of that with myself, with COVID, not simply blame myself or be angry with my body, but befriend it and take care of it. Witnessing refers to a kind of Buddhist mindfulness that's become very popular in the treatment of physical and psychological illness in many major medical centers around the country. But I'm going to skip over that. And then, in addition to saying, I have a body, but in other ways I am my body, another primary thing phenomenologists have investigated is the I can structure of my body. It's because of our bodily capabilities that have been habitually developed in certain ways that I can use language and you can understand it, or that you could get in your car and you could drive here today. So all the things we do demonstrate the ability, the I can structure of the body, but that experience of I can't, I cannot, begins to come to the fore with certain kinds of injuries, illnesses, and disabilities. So one strategy is restore it, that even though I can't do this in the present, at some time in the future, I will be able to restore the things I could do in the past. It's an interesting temporal loop. And that's certainly my hope, even though I'm very fatigued and my energy is very limited. I'm hoping that it will not prove too problematic to restore that. There are individuals who, for example, have long COVID or rheumatoid arthritis or simply the changes of aging, who will not necessarily be able to restore their prior level of functioning. And there you have to lean into something I call transforming. I literally transform the use of my body. I switch from one set of bodily capabilities to another, or I transform my environment to make it easier to get around, more assistive. And in order to do that, another thing we do is what I call incorporate, which etymologically means we bring things inside our body to assist our body. Sometimes that could be literally inside the physical body, like an implantable cardioverter device, a pacemaker. But it could also be, like in my case, wearing contact lenses, having flexible knee braces when I take those long walks that I mentioned. I use a CPAP machine to help breathe me when I sleep. And some people say this kind of cyborg-like nature of merger with the biological body and various kinds of assistive devices is more the norm than the exception, even if you're just wearing glasses or whatever. And these are enormously helpful, kind of bringing things from the outside in, but also going from the inside out, imagining. I won't go into, I don't think I have time to read some wonderful quotes, but Jill Bolte Taylor was a neuroanatomist who had a devastating stroke, and on her way to reclaiming the left brain functions that she had lost, she had to imagine herself once again swimming. She had to imagine herself, going back into the I can structure. And then she would be able to actualize it. Athletes do a lot of that, visualizing high performance scenarios and then being able to fulfill it. And even, the gold standard in medical research, where you have a double-blind study and one group is receiving a placebo, the other group is receiving the medication that's being tested. You have to do that because the placebo effect that comes from simply imagining that you're being helped by this inert sugar pill is so powerful in changing and healing the body that you have to make sure the medication on the other control arm outdoes it. And I myself have done a little bit of kind of qigong healing, imagining with this COVID I'm trying to get better from. It's definitely helped me in the past. So I'll leave restoring and imagining as applicable to me. Then there's the whole issue of how the body is very much temporal. It's very much, you could say, in time, or in a way you could say, in some ways, it is time. That's a little bit too philosophically dense to go into. But people deal with serious illness, aging, etc. This is pretty self-evident what these terms refer to. Remember it. I can't do things anymore that I used to be able to, but I'm consoled by the fact that I once did them. I once climbed that mountain. I once took that trip. I had this rich and full life. Or people can go toward the future. Anticipating. I can't do this now, but I anticipate that at some time in the future, I will be able to once again, either because my body will heal in and of itself, or because I will find a specialist who can finally diagnose what's going on with me, or maybe there will be a new medical breakthrough that will help me with this condition. And the problem with remembering and anticipating, the shadow side, is not really living in the present, but just, the sadness of nostalgia. Nostalgia literally means the pain of being away from home, or that anticipation, which brings about a kind of weird reversal of time. We're no longer necessarily moving toward a desired future, but we're often waiting. We literally are sitting in a doctor's waiting room. We're waiting for that specialist appointment 3 weeks from now, or we're waiting for that medical breakthrough 3 years from now. So we're waiting as the future very slowly comes toward us. And as somebody who's worked with long-term prisoners, and who thinks chronic incarceration is very similar to chronic illness, I know that feeling of waiting 20 years, until that release date might come. So another alternative is presencing. That some people say, I'm getting older, I have, a shorter term future ahead of me than I used to, or I have a fatal illness, or I'm somewhat disabled in terms of moving around the environment freely. But I can appreciate and experience fully the here and now. I can throw myself more fully in the present than do many of my healthy friends who are always racing around and worrying about the next thing that's going to happen. I don't want to focus too much on the next thing that's going to happen if I have a chronic progressive disease. I want to enjoy the here and now. And some people find their lives actually being enriched by illness. And another way that can happen is what I call re-envisioning, that with a serious illness or just aging or whatever, sometimes we really have to re-envision, who am I? What is the meaning of my life? What is most important to me? The product of that re-envisioning is not always positive. Once again, there's a shadow side where, as I mentioned, someone could feel like, now I see myself as less worthy or being punished by God because of this thing that has happened, or I'm somebody who now lets down my family. But this reinterpretation can also lead to a very positive narrative reconstruction, where you feel like your life has new sorts of meanings and maybe even greater meaning. Maybe we're moving more towards a source of true or ultimate meaning, as did the Buddha after his confrontation with sickness, aging, and death. So the last thing, we're almost to the end here. Thank you for hanging in there. I call reconnecting the body, because up until now, I've acted as if this is something that we sort of just do alone, within our own body, within our own interpretive structures. But really the body, from the very time of our birth or before our birth, we're part of a circuit of interconnection, intercorporeality, intersubjectivity. We literally were birthed within the body of our mother. It might have come from the intertwining of our parents' bodies, and even after our birth, we're being fed, we're being held, we're taught, we're being habituated and enculturated, and of course that never stops. We were just fed by some kindly people during lunch, and so this issue of the relationship between our bodies and the bodies of other people is really crucial in this recovery of existential wholeness. One direction we can go in is that of being objectified by the other. You have a point of view upon myself that I cannot gain, and especially with the tools of modern biomedicine, you can go right into my visceral body. You can do an MRI, you can do a COVID test, you can get all kinds of lab results, and you can arrive at a diagnostic assessment, and you can invoke medications and treatments, and you can do all kinds of things to me as object. And if I'm well convinced of the power of Western medicine, as to some degree I am, I do give myself over, kind of body and soul, to this process, and I'm very appreciative of it. So obviously, just in testing for COVID, that's one of the strategies I'm using. But then there's also the issue of not just being objectified by the other person, but realizing that we are co-subjectivities with them, that they are experiencing beings like we are. There may be other people who are struggling with the same kind of injuries or disabilities or illnesses that I am. And I can, the language I use, which is very religious in tone, is I can commune with that. I can become a self-help group for people with multiple sclerosis, if I have a condition like that. And they understand from within their body what it feels like to be within my body. And they have all kinds of helpful modes of support, encouragement, and just useful tips. And even if it's not someone who has exactly the same disease, someone who understands human vulnerability, someone with whom I have an empathic relationship. It could be a healthcare provider, but it could also be a family member, a friend, is there with me, and I don't walk alone. Like Jesus in the Garden of Gethsemane saying, just stay awake with me. We want someone who can stay awake with us in what we're experiencing. And that makes it, so much more bearable. Then I'm going to break out from that the issue of receiving. That when our body is incomplete, as it always is, it's not necessarily dependent. When we have a culture that really values independence and autonomy, and we're afraid of becoming a dependent person. But the truth, as I said earlier, is that we're all kind of interdependent, but there are times when we need to draw on the help of others. Like Dr. Zimmerman has been really kind in terms of picking me up and dropping me off and bringing me food and taking care of me while I have COVID. And I need to learn the difficult lesson, the challenging lesson in our society of graciously receiving that help. Sometimes that can be very hard for people to accept. But also the converse lesson that despite my disability, I still have a value, I'm still a value in the world. I still have contributions to make. And at times, maybe even more contributory or contributory in different ways because of the suffering and limitation I'm going through. So for example, in this talk, obviously I'm trying to incorporate my own experience at the moment with COVID as part of what I now have to give and share. So I weave on the board where I put my pieces on the chessboard of healing. And I think the idea is that individuals may put their pieces on certain spaces because that's their personality, that's their habitual modes of coping. And it may to some degree be functional, but it may also be limiting. It may also have shadow sides. If you're the kind of person who always ignores and refuses, for example, and renders yourself vulnerable to further injury. You may have to move your pieces to different places on the chessboard because the illness itself may be constantly moving around, changing and progressing. And you need to be adaptable, you need to be flexible, you need to understand the entire terrain of places you can move to. And so this is, designed to be something of an assist to that. So thanks very much for listening.
Okay, thank you very much, Dr. Lader. We have good time for questions. So please feel free. We also have coffee in the back. I don't want to risk you all storming off, grabbing a coffee to, re-energize, but there is that. So please, if you have a question, I'll hand you the microphone and feel free to ask it.
Thank you very much. I wonder if you'd mentioned before two different options, that I am a body or I have a body. Is it that I wonder if you can expand on that a little bit. Is it better to sort of envision life as one or the other, or are we constantly moving between them, and which sort of philosophical default leads to a greater sense of healing, wholeness, or happiness even?
Yeah, that's a great question. And I would say, I'm speaking a little bit in the name of these famous phenomenologists I mentioned, Merleau-Ponty and Husserl, they would say it's a fundamental ambiguity, or you could say ambivalence, moving in two different directions, is always present, and that kind of structures our embodiment. As I mentioned, in a certain way, it's constantly transcending itself. It's constantly, in a certain sense, forgotten about. And in that way, you could sort of say, I am living out my body unproblematically in my interaction with the life world. So in certain ways, you could say, well, that may be preferable. It has a nature of ease rather than dis-ease. But it's also true that we tend to, I often forget to do this, but we want to look in the mirror before we go out in public and hope there's not a booger hanging out of our nose. We have to be aware of ourselves as open to the gaze of others. We have to be very aware of what our body can and can't do in terms of our physical strength or vigor. And so in that sense, we're always kind of going back and forth. I think it can be dysfunctional. Let's say you have a serious illness and you get stuck solely in this feeling like I have a body and my body isn't me, especially if it's in that mode of alien presence, stranger, intruder, or enemy. But there are ways, like I've looked a little bit at anorexia, and that's one way anorexia can manifest. I have this body, but the body and its hunger is kind of my enemy. But one treatment I've learned about for anorexia can be really learning to befriend your body. Yes, you do have a body, but the messages it's sending you, you can be collaborative with and can be helpful. So I think it's not only I am or I have, but in what way do I have my body? Is it an enemy? Do I befriend it? So it seems like a simple question, but it's a really multi-layered question.
Thank you. Next question, please.
I found this very helpful, especially the identifying the benefits and the shadow side of each one. I'm wondering, looking at these, if you would say there are some that are more helpful in maybe dealing with chronic illness and aging, that are less helpful, and is it helpful to help people move from one to the other as they're dealing maybe with disability, that sort of thing? Is it personality?
Yeah. I've been very sort of methodologically and systematically resistant to saying that anyone is more helpful than the other. Because, for example, let's say one has rheumatoid arthritis, which is limiting and can be painful. One might say, screw it. I want to go out and garden this morning. I refuse to be limited by this condition. I need to get my hands into the soil and I need to experience the fresh air and the sunlight. So I'm refusing and ignoring in the morning. But comes the afternoon to the early evening, when that's often a time of onset of pain and limitation, now I need to move much more toward listening to my body, befriending it, taking a hot bath, giving it rest. So these alternation of strategies, sort of moving to different places on the chessboard, could literally take place over the course of a day or an hour. One might decide, for example, I'm slated to fly home on Saturday. I might see if I turn COVID negative, but it's also occurring to me I can't get a direct flight from Vancouver to Baltimore. So it's going to be probably about 13 hours of travel, with luggage. And it's going to be what I call in sports lingo a game time decision, whether I really can do that and I'm going to refuse to be limited, or whether I need to listen carefully to the messages of my body and wait another couple of days before I travel home. So I don't want to say one is better than the other. Ordinarily, one might say befriending and listening to your body is better than refusing or ignoring it. But I think, this can go in different directions for different individuals at different times. Does that make sense to you, or do you have if you have a disagreement with that, please voice it, or.
Any other questions?
Thank you for the presentation. I find this really interesting, especially this sort of chessboard analogy. I actually work in long-term care in spiritual health, and so maybe just to open up the conversation, like, would this also apply to even spiritual care and even pastoral care? How does that kind of lend itself to, especially when you have to go back and in spiritual health here, you have to you have to chart out what you're going to follow up with, but then how does this kind of interact with that kind of methodology?
Yeah, just to be clear, were you saying that your long-term care, so these are individuals who have physical
Yeah, so they have
limitations?
physical and they're not able to live at home and not able to, or taken care of by the family, and so they're there, just in this, and often lost because they're taken out again of their community.
Can you say the last sentence again?
They're often lost because they're taken out of their community.
Yeah. So I think there's one way this so-called chessboard of healing can be useful is kind of as a diagnostic tool. For example, I hear you saying these are individuals who are not communing sufficiently with family, friends, and like-minded others. These might be different individuals who are struggling with this issue of kind of transcendence. What is it within the self that transcends what's going on within their physical suffering? These are individuals, in other words, rather than give you an answer, I'm hoping that this provides a way for you to begin to pinpoint here are some places on the chessboard that could be really valuable for them in, as you say, a healing which is to some degree can be physical, because how we're doing emotionally, mentally, spiritually can definitely affect our immune system, our level of functionality, but also how they're doing psychologically and how they're doing spiritually. So I'd be more interested in the long run in hearing from you than telling you your business.
Thank you.
Any other questions?
I'll make that one. Yeah. I haven't articulated it in my mind. Can you say something about cultural differences in terms of how all of those elements might look different in a non-Western setting or in a different cultural setting? How does cultural beliefs being situated in different cultural settings, how might that affect the chessboard that you're describing?
Yeah. I can respond to that, and I can't respond to that. The can't respond to that is that I don't feel like I'm very interested in non-Western cultures. I do about half of my teaching in Asian philosophy with a particular focus on Hinduism, Buddhism, and Taoism. And in both my books, as Dr. Zimmerman knows, The Absent Body and the Healing Body, I turn to non-Western paradigms at the end for positive models of how we commune in somewhat non-dual ways, how the body connects itself, connects us very profoundly with the human and the natural energies of the universe and the divine energies of the universe. I haven't looked really deeply into how there are, a lot of studies in medical anthropology about how people respond to pain in different cultures, how they describe it, where they localize it within the body. Like a couple of studies that come to mind to me that might be relevant is a study of chronic illness among Buddhist nuns, where, let's say, communing for them primarily and transcending for them primarily does have to do with their internalization of the story of the Buddha's confrontation with suffering and the methods of mindfulness and compassion that help to resolve that, and their connection with the community of nuns. Whereas conversely, with Chinese individuals in a different study who are dealing with chronic and perhaps even fatal illness, their primary concern remains within their family, very family-oriented culture, if you want to make a generalization, and whether or not they'll be around to give to their children. But in Chinese families, there's also an ethos of really receiving care. The young people will take care of their parents. I have two daughters. One was here in Vancouver. Both of them are adopted from China. And this was during the one-child per family policy. And the idea of one of the, kind of sexist, patriarchal notions that led to the discarding of all these female children was that the male children are the ones who really stay with the family and will take care of you when you become an elder, whereas the female children marry you off, they move to a different part of China, they're not there for you. So having a boy will be your social security system. I've been told that that is not the case, that in China, as is often true in Western cultures, it's often the women, the daughters, who end up caring for their parents. But so these squares take on different valences in different cultures, but I don't have sufficient expertise to say too much about it.
Yeah, I guess I said, I'm American, I'm going to lead. Yeah, just in response to what you said, I wonder, now I'm not an evolutionary psychologist, okay? So I don't want this to be taken the wrong way, but I wonder what the evolutionary history of our species would say in terms of invariances across cultures. So yeah, there's going to be play in different cultures, but there are certain things that are maybe rooted in forces that aren't as plastic as, say, our conceptions of things and our traditions, such that you won't find any culture, I don't think it could be this plastic, where agonizing pain is understood as something we should pursue. Or you could develop a number, I think, of invariants across all cultures. And I wonder, I don't see any evolutionary background to these, or maybe legitimization of these separate squares. I wonder if you've thought about that, I'd like to hear your thoughts on it.
Yeah. The short answer to your question is no, I haven't thought about that, which is curious, I guess, because of my phenomenological experiential orientation. In that method, you sort of bracket out the whole scientific story and other metaphysical stories to go right to lived experience, which for me is in the 21st century in a Western context. I would say I do believe, as a philosopher of the body, that things are not open to an indefinite array of cultural variations. Like to go back to what I started with, this notion of the projective, ecstatic body that is self-transcending through vision or hearing, etc., and the recessive body, where the parenchyma of the liver, there simply is no sensation of, there are no, kind of sensory mechanisms there. I think these establish certain kinds of cultural invariants. But at the same time, it is interesting, almost like a piano, which has the black notes and the white notes, and can produce certain tones and not other tones. But different cultures can play on that piano differently. So in, let's say certain kinds of yogic or Buddhist mindfulness methods, you can develop a much deeper awareness of and control over visceral functions than we would have expected here in the West. I could give other examples. So it is very interesting how I sort of say, instead of invariant, I kind of say vectors. The body establishes certain vectors in different directions. But in many cases, it doesn't absolutely mandate us in our experience and interpretation. But I think in some ways it kind of does. Like you were saying, it's hard to imagine a culture. Well, Ramana Maharshi was somebody who was dying of, I think it was throat cancer, a very esteemed Hindu saint, who was in pain, but he also wasn't in pain. Like he was in a great deal of pain, but it didn't disturb him. But outside of these kinds of fully realized beings, and we could talk about Jesus on the cross and his excruciating pain, it's hard to imagine a culture where pain wouldn't bring forth the body as an alien presence with a mandate toward interpretation and remedy as much as possible. So that leads us back to the invariant.
You mentioned that in both of your books, you sort of make recourse at the end to Eastern philosophical paradigms. Curious what those paradigms you harness believe about the state of the body after death, and how those beliefs may have influenced your own thinking about the body and developing this paradigm you shared with us today.
So you were asking mostly about Eastern?
Yeah,
paradigms?
the paradigms that you make use of at the end of both of your books. I'm just curious if they have particular beliefs about what happens to the body after death. Yep.
Dr. Zimmerman talked a bit about the Christian notion, including the resurrection of the body, a spiritual body, and the way in which Christianity takes the body very seriously. This is something I run into when I teach Eastern philosophy, and I try to do it in a semester, because there's all the richness and complexity and disagreements that one would have in Western philosophy. So obviously there's the doctrine of reincarnation. When our physical body falls apart at death, there's still a subtle body or an astral body or a karmic body that includes the kind of karmic energies and lessons that we've learned in one life. Those are not simply lost or abandoned or the end of the story, because that's one of a great series of lives, and we will be reborn into a different body. I describe it to my students a little bit like when it's time to get rid of one computer and get another, get rid of one smartphone and get another. you're discarding one physical mechanism, but you're kind of downloading maybe what's most significant from the first one into the second one. So you don't retain necessarily specific memories, but you retain whatever you have attained. But then there also are notions where, like in Hinduism, you basically, when you've fulfilled your incarnations, you simply merge back into the one, the divine Brahman. And in Chinese Taoism, there's a sense that we're part of a circuitry of nature. We emerge from the Tao, and life is a part of that, and then death is a part of that. And in Buddhism, of course, there are different beliefs, but there often is the sense form emerges from the formless, and then it transforms, it deforms, it unforms, it goes back into it. And there's a continual turning of the kaleidoscope, a continual turning of forms, so that in a certain sense you're not reincarnated, but insofar as you identify with the universe universing, you realize that the sense of the separate individual was always fictional to begin with. There's the notion that you never die because you were never born to begin with. You were simply kind of a transient manifestation of the universe. So, once again, a simple question, but maybe too complex an answer.
Okay, I think we can draw to a close at this point. As you can imagine, we had Dr. Leda for a couple of days of seminars on his books, and it was precisely at this point we had really interesting discussions about the different views that the union beyond the here and now, what that would work. Like we're moving toward union, what would that look like, and well, how would such a union in Buddhism, in Hinduism, or in the Christian faith retain or not retain a body, retain individuality, not retain it. Really, really fascinating things that all are part of the chessboard in here, depending on what you believe. So thank you very much for your lecture. Thank you for being with us and hanging with us despite the COVID.
Thank you very much.
Let me just give him a hand. We have to wait for a few more minutes, so if you can make a beeline to the coffee or the tea, please feel free to do that. If there's any food left, feel free to stuff it into your pockets, because it's all paid for, it shouldn't go to waste. And let me just encourage you to keep checking on the Houston Center webpage for events for the fall, for September and October. We have some really neat things coming up, so please do check that out, and it'd be lovely to have you for any of those. Thank you very much for coming.